and welcome to the Vet Record podcast in association with Zoetis. So today is the second of our podcasts around the use of artificial intelligence in practice. And today we're going to be looking at the ethics and legalities around using artificial intelligence. Again, I'm joined with my dream team of Adele Williams, clinical director for a data consultancy firm called AIWX, and Bobby Hyde from the University of Nottingham, and also VetVision AI. So welcome again, guys. Nice to see you.
Thank you for having us.
Thank you.
Yeah, great. So I think we touched in the first podcast on some of the ethics and the legalities around using this in practice. I mean, I suppose one thing that comes up really commonly is this idea of where does clinical responsibility start and stop. So that's probably quite a good place to dive into this. So perhaps Adele, come to you first.
Thank you.
Perhaps I should have done it the other way around again. But
No, I'll jump in. I'll be happy to. I think as far as the UK is concerned, and the RCVS have been really, really clear that the clinical responsibility for a case and for the decision making a case lies with the vet. Whether you use AI or any other diagnostic tool, the decision that you make in the end is ultimately yours. And so I think that's really important for people to bear in mind when they're using AI tools, and why AI literacy is so important for people to be able to understand the outputs that they're getting from the AI tools.
yeah, so that's really clear. But I suppose then the next thing is, how do you use it to help you with your clinical decision, I suppose, isn't it? So perhaps Bobby, come to you on that one, and then Adele will come back around to you.
Very happy to go second and pinch Adele's good ideas. I completely agree. It's a vet's clinical decisions and clinical judgment. That is your role as a vet, and that's your responsibility. And I guess AI moving very, very quickly, there's a lot of talk about, what does this mean? Who's responsible? And of course, this is in many ways not a new question. We're currently using blood results to help make clinical decisions. We're using radiographic images to help make clinical decisions. We're using lots of these individual tools with our clinical experience and clinical training to make that decision. And AI is another tool, and it's a potentially quite exciting tool in that regard, but it is another tool. And it's part of that toolbox, but ultimately it does come down to the vet then to make that decision, and that's where responsibility lies. I would say as well that, of course, in the same way that diagnostic laboratories are responsible for their tests and maintaining their accuracy and reporting those metrics, it's the same for AI companies as well. And there's a burden on those companies as well to make sure they're providing the clinicians with the information that they need to be able to interpret those tests correctly in order for them to be able to do their job.
Yeah, I think it's worth saying, I mean, the ultimate decision making, the ultimate responsibility for a case in terms of negligence is the vets, but that doesn't mean that the AI companies are without liability. If they market a product saying that it is suitable for a particular purpose, and actually it's faulty, it is not able to diagnose things correctly, then there is a liability there as well. But vets cannot avoid, they can't say, well, the computer said this, and get out of jail free card for their decision making there.
Yeah, absolutely. So I suppose to a certain extent, if people, like you say, because it's such a new area and sort of moving quite fast, I think people are worried, but actually thinking of it as just another diagnostic test is quite a good way to make sure that you sort of fit within the sort of boundaries of what's going to work for you, work for your clients, and work with the RCVS guidance there. Yeah, that makes
It's definitely quite an interesting question, though, isn't it? And there's lots of literature on trying to improve the performance of models and so on. And there's not all that much in terms of, if you then give it to a clinician, what do they then do with it? And there's some quite interesting studies in human doctors anyway of looking at ECG results and so on, and then providing those to the clinician as they were, or providing them to the clinician with a machine saying this is what the diagnosis is. And it definitely does influence people's behavior after that, and quite deviously, if you give people wrongly classified things, that you say, the machine's got this and it's got this diagnosis, and it's actually incorrect, it does tend to flip their decisions that way. So it's definitely a risk that we're worth thinking about. As Adele's saying, it doesn't mean you can just throw out any old algorithm you fancy and expect clinicians to be able to interpret that. If you're giving people an algorithm that is saying the wrong thing, that will be biasing people's clinical decisions. It's their responsibility, but it will be pushing them the wrong way. And that's something that, we need to be really, really careful of.
Yeah. And I mean, you keep talking about that idea of that it's got to be fit the purpose that the company is launching it for. How can you know that it is, I suppose? I mean, Adele, I know you've done some work with clients on this.
Yeah. So I think because we don't have any regulation of veterinary medical devices at all, of which we're classing AI as a veterinary medical device here in this sort of conversation. It's then down to us, the users, to do the governance, to do the checking. And so there are questions that I advise should be asked when looking at adopting an AI tool about what data it was trained on, and does that data relate to data, the kind of patients I see in my clinic. So if it's just been trained on a particular breed of dog, and I actually don't see many of those breeds of dog in my clinic, is it going to work on my client base, on my patients in the same way? So that's sort of the sort of one of the foundational things. What data was it trained on? How accurate is it? But that's a really difficult, and that's a whole nother conversation about the definition of accuracy, because
Yeah.
accuracy when you're building an AI model is not the same as accuracy would be to a clinician wanting something that's going to really pinpoint a disease, yes or no. And what are the limitations or biases? So if a radiology AI tool, has been trained to look at chests, is it going to be any good to look at fractured limbs? For example, this is just really simplified examples, but just sort of to get people thinking about actually like what are the use cases that I can use it for, and is it going to be useful in my population of patients? I'll let Robert come in with some suggestions as well for what people should be checking for how the AI works and etc.
It's certainly really difficult, isn't it? And I think there's a lot of vets are a gatekeeper of a lot of things, aren't they? What types of drug to use, what types of tests to use, how they're accurate they are. It's a very, very challenging job to keep abreast of all these and to have the skills, I suppose, to know whether a model is doing things well or not. And I think Adele's point is an excellent one on the types of data that has been used to train the model, how that data has been curated, and what kinds of animals are within that data. And
Yeah.
we've certainly seen that a lot in human AI models that are trained on particular races, particular genders,
Oh, yeah.
that are then very, very specific to those categories. And of course, that might not fit your clinical practice, and you introduce bias into your models. The accuracy as well is a really difficult one, as Adele said. And I suppose maybe a slightly extreme example, if you were testing your algorithm on 100 cases where only one of those cases actually had the disease and 99 didn't have the disease, your model would be 99% accurate just by guessing no for every single one of those 100. And of course, that's not a particularly useful model for us as clinicians, and yet the headline figure is 99% accurate. So we do have to be a little bit cautious, I suppose, and definitely delve into, as soon as people hear the word accuracy, should always say, well, I need to look at sensitivity and specificity as well. And in the same way you would with any diagnostic test. But it is challenging to keep abreast of them. I think part of it is, I suppose, trying these things, but being able to see what decisions the model is making. It kind of strikes me a little bit like, our first days as new graduates, we weren't necessarily released day one onto the most extreme and life-threatening cases, and no feedback whatsoever from our bosses. You kind of hopefully get access to maybe slightly easier cases, and then you have a check-in with your boss and say, right, well, here's what I did, and that seemed to work okay, and that was a good result, and then you slowly build up kind of trust it over time. And I think that clinicians are rightly very shrewd with that kind of information. I think if as long as they're able to see the results of the model and see that, yes, okay, that's worked and that's what I'd agree with, and then again and again and again, you can start to build up trust in that model in practice. But without that clarity and that transparency, that becomes, as a clinician, really, really hard to do if you're just getting this black box answer and no ability to see what's going on.
And I mean, I suppose obviously these companies, that it's not regulated in the way medicines are, but I mean, they're presumably wanting to build long-term businesses. So are you finding that you can get to the information you need from most of the people offering these types of services and products to vet practices, or is it a bit variable on that?
Personally, I think I find it a bit variable.
Yeah,
Some people are incredibly vague, and it should be really clear, at least to glean some information from reading the terms and conditions of how it works, what type of AI model is behind it, at least, if not details on the data that the AI was trained on. And it's not always clear in all of the models that are out there. And I think what we're also lacking is sort of validation studies where an AI has been tested independently of the manufacturer,
yeah,
for want of a better phrase, and had a sort of peer-reviewed publication looking at how well or poor a tool does at helping with a specific use case. And I think that we need to start seeing more of those to actually really gain a higher level of trust of the AI tools. And that's probably what clinicians are looking for, and where a lot of companies are not yet at, I would say. Robert, do you agree?
Yeah, I'd certainly agree, and it's very variable. And I think for certainly some advertised services, it's impossible to know. There are companies that will say, yes, we can detect this disease, and that's as far as you go. And it's very, very hard as a clinician to then say, yes, I'm gonna rely on that to make my clinical decisions. I would say, however, I guess when you are able to show the results of models to vets, to animal owners, and you can show that it's working, it's really phenomenal, actually. And I guess I'm quite lucky in some ways of my main field of AI being computer vision, which of course is quite visual by its nature. And of course, you can then show people a video or some images of their animals, and you can show your algorithm spotting what they're doing, where they're doing it, and you can show them a map and say, look, it's saying that they're over here lying down in the area they should be lying down, and they're over here feeding in the area. And very quickly, you can just show that that works. And immediately you get at least that baseline level of trust of, yeah, I can just check into this every single day, and I can see that it's picking out what the animals are doing, where they're doing it, and then we can start to use that information to make clinical decisions about their management. So yeah, I always feel quite fortunate in the computer vision space is it does allow you to kind of show visually what's going on quite easily, actually.
And Adele, I mean, are you finding when you're talking to clients about introducing this stuff, does that level of transparency influence then which software and which products they're choosing?
Yeah, absolutely. I think it's less of a warning light for people that aren't clinicians. So sometimes the decision makers in practice are not clinicians; they're
Yeah,
the owners of the practice, and it doesn't. They don't understand the importance to us as clinicians because it's not their right to practice that's at risk if it goes wrong.
yeah,
Whereas the vets on the ground are very, very concerned with this. They need to know that it's trustworthy and that the results are going to be usable for their cases to use it. And I think there's a little bit of a disconnect there between the people that are paying for the tool and the people that are going to be using it, and what the risk is to those relative people in terms of their use of the tool.
And
mm,
that risk becomes even more magnified, doesn't it, when we remove that even further and go to the owner potentially as well, and then maybe even with less oversight, and then they would maybe come back. And it's the same way, the idea of kind of Dr. Google, isn't it, of people just searching for things, trying to find things, and there are now tools that owners can use unaided, unguided, and then might present back to the veterinary surgeon to try and untangle that. And might be fine, but might be leading people down the wrong way, which is an extra challenge maybe for a vet to reset that course potentially.
Yeah.
yeah. And I suppose thinking about that transparency with clients, are people telling? Is there a sort of requirement to tell people that you're using it, or can you just say, "Oh, it's another diagnostic"? So you and I suppose what a client's responses
Yeah.
to that?
So again, going back to the RCVS, on the basis of the roundtable report on vets using AI that they released last year, they said that we need to be transparent with owners about AI tools. We need to educate owners about AI tools, and actually enhance the vet client relationship by helping the owners to understand why we're choosing to use certain tools, or why we're not using them as well.
Mm.
There's that whole educational owners piece as well, but the vets need to be educated first and understand it first. So there's a lot to do and think about there.
Yeah, and it definitely seems, I think, at the moment, from my experience with practitioners, that I think most people are um, quite quick at telling owners, and quite pretty good actually at telling owners that they're going to use a certain type, or would they like them to use a certain type of AI. And I think the response rate, certainly, I don't know if you'd agree, Adele, from my anecdotal experience, is that most owners seem very, very quick to use it actually, and very, very keen to use. And that there's very few people that have turned down the use of AI in practice situations because of worries about how it's being used or anything like that. And which is great in some ways, is that there's some trust in there with the vet, I suppose, well. But I suppose there's a bit of a concern there as well, isn't there, that this kind of almost blind trust in
Yeah.
from an owner's perspective that maybe needs a bit more going into with the vet to explore.
There's a bit of naivety. I mean, AI has
Yeah.
had massive hype since ChatGPT
Yeah.
came onto the scene 2 years ago, and now it's being used in workplaces in every different type of profession and domain, and so people are very used to it, and people are starting to see how useful it can be. So there is this sort of naive acceptance by owners of how great it is, and they don't necessarily have the thought that, oh, this might be dangerous, this might be wrong, which is sort of, again, we're the guardians, aren't we? We have to be there and look out for the negatives as well as the positives when using these tools. Also brings into the question of informed consent and how far do practices go on getting consent from clients to use. They have it as part of a consent form when they come into the practice and sign up, and it generalizes to then the pet's lifetime. Is it something that they have a notification on the wall or send a generic email around notifying people we're now going to be using AI? Is it something that's discussed in person in the consult room and noted in the medical records, on a case by case basis where it's used, and what I find is that most practices do not have an AI policy at all, and it can really help sort of set the boundaries and the level of understanding in the staff if you have a practice AI policy, so that everybody understands how we should be talking to clients, how we should be using it, how we shouldn't be using it, and where it's safe and not safe to use it, etc.
I think that's a really good point, actually, isn't it? As you would have a lot of other policies in place. Yeah, why not this? I mean, you touched on it again. I mean, and I think we spoke about a little bit about it in the first podcast, but obviously there are cases of false and unreliable information being generated. And, what do you think the actual real risk is there for veterinary practice?
I mean, it can be potentially very damaging. I mean, the worst case scenario is that an animal is not treated in the correct way, and life is lost. That's the worst case scenario, which is devastating for the owner. It's devastating for the vet, and it's really, really bad for the practice as well. So that's kind of the worst case scenario, and that's why it's so important that the vet understands how the AI works and remains the decision maker ultimately.
Perhaps answer that, and then I'll ask the follow up.
No, I was just going to add. I suppose it's quite important to move quite slowly in how we start rolling these out with exactly that in mind of not just releasing straight away to a really critical case where we're going to make a life or death decision. Potentially, I suppose it's using it as part of the set of tools that we have, and helping us make those decisions in the best way we can. I think limits that risk to some extent, but it does depend on the case, and it depends on the disease that we're looking at, I think, quite a lot. So yeah, we just have to tread a little bit carefully and until we get our case. And that being said as well, it's important to remember that not using AI is also dangerous, and clinicians, with the best will in the world, and it doesn't go correct every single time, and same with diagnostic tests, they don't always get things right, and there's sensitivity and specificity to every decision we make, whether aided or not aided, and there's a real risk to not using AI in that we potentially miss some amazing sign, and we could so I suppose that there's false positives and false negatives with both scenarios, aren't there? And I think we just have to tread a little bit carefully, but I think ignoring it completely is also a potentially dangerous path as well.
And are you finding practitioners are able to identify when they're like, oh, hang on, this doesn't seem quite right? Are they able to sort of pick up on that?
It's variable again.
Yeah.
So and there's been some research shown that clinicians in the medical field have missed mistakes that have been deliberately put in by AI. I think it partly comes down to time.
Yeah.
If you've just got to review something before accepting it into the clinical notes, if you've reviewed a few times and you generally agree with what's said, then you may be less cautious in your review in the future. And that can become dangerous because that's when mistakes can be missed.
Yeah.
And the other is, I suppose, to do with your level of knowledge and competence in a particular subject and your level of confidence as well. And if you've got a tool coming up with things that you hadn't thought of, you're going to think, oh, well, it knows better than me, so I'm going to trust it. And there is a tendency to trust the machine. And there's also particularly the AI that's built around the large language models, so the chat GPT type models that produce text and other things as well. They are designed to write something that is very believable, and so that is where people can be caught out, because it is trying to please you with what it's saying in a way, and so it will say things that sound very real and very accurate and aren't necessarily so there is the potential for people to not be so familiar with the subject and to believe what the output of the AI is saying without questioning it more thoroughly, and that's, I think, is a real worry of mine.
Yes, I think I saw something recently that something's been withdrawn because it was too sycophantic or something. So this idea of AI being trying to be as agreeable as possible, you can see that people will fall into that. I mean, Bobby, what's your view on it? Obviously, the farm side of things is a bit different, isn't it? With the I suppose the amount of data, the amount of animals being sort of processed.
And I think it's applicable across species and disciplines. Actually, I think there's a real place here as well for some clinical audit as well. And in the same way, if we were to bring in a new surgical technique into a practice, then the process hopefully would be that you would start to audit the outcomes from those cases and say, are things getting better? You'd hope so. If they're not, we need to know about it and see what we need to do to change our methods. And it strikes me, this is as a new approach is just another new approach, and we should audit that in exactly the same way and start to see the outcomes from whether it's clinical note taking or diagnostic tests or general animal outcomes when we use an AI tool versus we don't, and start to measure things objectively. And I think that might go some way to some of the previous discussions we've had in the last question on, is it beneficial or not? Yes, we will almost certainly get some things wrong that maybe we didn't before, but if we get one minor thing wrong and we get 10 new things right with this new approach, then that's definitely worth doing. And the surgical metaphor, without wanting to take it too far, I suppose going down the route of sort of keyhole surgeries and things like that, okay, there's a small chance of something bad happening that maybe you wouldn't have had with an open surgery, but a lot of times when that will actually be much less painful, much faster recovery, and so on and so on. So and that's a practice by practice or practitioner by practitioner decision, then, isn't it? Is what surgical approach am I going to take here, based on the literature, based on a clinical audit, and your own experience.
Yeah, absolutely. Great. Well, I think we're coming to the end of our time, but I think that's been really, really good discussion there. And I think, again, it pulls out that idea of, to a certain extent, is don't be scared. A lot of what you'll be doing in practice generally can be applied to these AI tools. But perhaps a few things to think about is, encouraging that transparency and getting that research done so people can really look at it, developing an AI policy, and perhaps looking at training your staff so they can interpret it better, and then that clinical audit piece. But Adele, you look like you just want to come in at the end there.
Yeah, no, I do. There's one other really important thing that we need to think about, which is the data protection.
Oh, cool.
When providing a third-party provider with data that belongs to our clients, we are becoming data processors, and we are bound by legal rules in that, and so we need to be very careful when implementing tools that they do abide by UK GDPR regulations, for example, and some of the tools coming from over the other side of the Atlantic, which there are many, AI software companies from over there, aren't necessarily GDPR compliant. And I think that's really, really important for people to check as well when they're checking, and to ask, what are you doing with my data? and what happens to my data as well, which is not my data, it's my client's data. And I think that's really, really important.
Yeah, absolutely, really is. Bobby, any final words from you there?
Yeah, I think you summarised quite nicely, and for me, there's definitely some risk, and I think we need to move fairly slowly in a very fast-moving field in our adoption, and it's important for companies to be able to give practitioners the transparency in their algorithms so that the clinicians can make a really informed decision. I think I'd probably end by saying that whilst that we need to move slowly and cautiously, it definitely is a risk not to use these tools as well, because they are amazing in many different ways, and I think whilst they will never replace a vet and shouldn't replace a vet, they provide the vet this incredible ability to do their job in a way that we couldn't before, which is really quite exciting in terms of improving animal care.
Brilliant. That sounds like a good place to stop, doesn't it?
Yeah.
Thank you.